Great. All right, it's 1:30. Welcome to your Benton-Franklin Health District meeting. Today is Wednesday, March 18th, 2026, and the time is 1:30. And we will call the meeting to order. We're going to do item number 2, approval of February 18th, 2026 regular Board of Health meeting minutes.
I move that we approve the regular board meeting minutes from February 18th, 2026.
We have a motion. Do we have a second?
I'll second that.
We have a motion and a second. All in favor signify by saying aye.
Aye.
And the motion. Thank you. We'll go down to public comments. Anybody here in the audience here present for public comments? Seeing no takers, we'll move on online.
If you would like to make a public comment, you can raise your hand in the Zoom app, or if you are on your phone, you can press *9 to raise your hand.
And we see no hands raised, so we'll move on and we'll close out public comments and go to item number 4, director comments, if there are any. Oh, come on. That'll make me so sad.
They heard you say you're gonna start.
We'll move down to number 5, unfinished business. It looks like there is none at this time. I don't see online here real quick. I'll just pass on. Go to the next thing. New business, item number 6A, Office of Health, Office of Health Officer update. And Doctor, are you ready to go ahead and do that?
I am.
Thanks, sir.
Good afternoon, everyone. Looks like Lauren has my slides, so that's great. Okay, so I got an upgrade in my slides today. Amanda and Noelle helped quite a bit, so they look really nice, which I'm excited about. Hope you all are doing well and enjoying some of the nicer weather. So I have a couple things to talk about, less like medical things and more policy based today. So we did an interesting, let's go to the next slide. Myself, Vanessa, Heather, Carla, and Aaron, we made it to Public Health Day at Olympia, which means basically like local public health, state public health, academics from the Washington State Public Health Association. They all kind of come together and try to just educate legislators about public health and what our priorities are and what we're worried about. So we had wonderful preparation by our communications team. This is the work that we're doing at BFHD. We think it's really important. Here's how we think our funding can be supported going into the future. So we met with various representatives and senators as well as their aides. And it was a lot of fun. It was the first time I'd gone, so it was a learning experience for me. But it was, interesting to learn more about the legislative process, as well as about, what the priorities are for our representatives, what they're thinking about, how to best communicate with them. So I found that really useful. Let's go to the next slide. So we focused on 3 things. FPHS, which is Foundational Public Health Services. The original governor's proposed budget had a significant cut for that. So we had been worried about that just as a system. But Foundational Public Health Services has supported a huge amount of work the last few years, building up staff and workforce and infrastructure that is hard to replace and would be difficult if we kept having kind of funding swings up and down. So we kind of talked about the work that funding has supported. This I'm less able to talk about the details, but there was changes to how vapor taxes were collected, cigarette taxes, and where they were allocated. A good chunk of them used to go into Foundational Public Health Services, and that changed from a rule last year. Unfortunately, that seems to still be. We had hoped that would get changed back to the way it was, but that's going to be that did not happen. So that means we will see some cuts to our overall Foundational Public Health Services funding. And then we also talked a little bit about House Bill 2242, which covered a few things in preventive health, and I have a slide on that. One quick thing before we go to the next slide. I don't know what it is about this picture, but I am I think standing a little bit closer to the camera, and it makes me look much taller than our staff, and I just don't think that it's that dramatic. So anyway, I just want to point that out.
Hey,
All
but
right, let's
Dr. Krager, where's your silly face at on the picture? Yeah, where's your silly face?
I was guessing you're like about 6'3", 6'4". Am I right?
We're gonna
No,
share
five-
our silly
5'8".
pictures.
5'8", he's 5'8".
Hilarious.
Some when I saw this picture, I was like, that doesn't seem right. Something's wrong. All right, let's go to the next slide. So this bill, basically, it was kind of a fix. It didn't make any major changes, I would say, but it kind of fixed some language in some of our statutes. It passed with bipartisan support. Just making sure that we continue to have no cost coverage for preventive services was the main goal. There's some language between like federal laws and state laws about what insurance has to cover and what it doesn't. And this kind of clarified that to make sure that we continue to our insurance companies in Washington continue to require to cover preventive services at no cost. Those are things like mammograms, colonoscopies, vaccines, kind of other tests that are preventative going into the future. It made some language changes around DOH vaccine recommendations. Again, just clarifying that, I think there's been some concern about like mandates or law changes around vaccines. That didn't change at all. It just essentially clarified language around what our state recommends for vaccines and how that gets determined. And then the U.S. Preventive Services Task Force, they are also tied to insurance in terms of what they recommend is if it's like graded at a certain level, insurance companies have to cover that. So the bill made sure that that was aligned as well. All right, let's go to the next slide. This is a really interesting thing that I am very curious about how it will impact our work going forward, as well as just our community in general. So, as part of HR 1, I believe was passed last year in the federal government, um, they set aside $50 billion nationwide to specifically focus on rural health. So this is coming from CMS, the Centers for Medicaid and Medicare Services. So this is federal funding. And they kind of made a pretty open-ended, like, how are you going to support rural health over the next 5 years in your state? And how might you innovate? How might you shore up, any problems you have with rural health? And so we actually did some partner listening session late last year. We then provided input to the state, who then provided their kind of application to the federal government. And focusing on, access, which we know is always an issue in rural healthcare areas, how we can use technology to improve that access, making sure we, have adequate workforce to treat our patients, continue to focus on chronic disease, and then, innovative care models using technology, kind of changing the way we might do things to make things more efficient. Okay, I think I have one more slide. So this is very much up in the air. The state has like a webinar coming up next month. But essentially what I think it will mean is the state will open up kind of RFP processes to allow, organizations, businesses, health departments to kind of, propose plans for how they might, impact this rural health transformation program. So I think we need to, this just occurred, so it's very new. I do think we need to have some discussions internally, but I'm also curious, from your standpoint, kind of what priorities you think are important, what we want to advocate for, how we can help our partners, potentially get funding for interesting programs. So that's kind of my ask today is if, obviously, you can read more about it. If you want some more information, I can certainly send some along. But it's a very open-ended opportunity, I think, for some interesting funding. So I wanted to share that and see if we had any feedback about that. I think that's my last slide. Great.
Yeah, I do, Dr. Krieger, thank you for your report. I do have, possibly a suggestion. When I was working for the Greater Columbia Accountable Community of Health, which is Greater Health Now, we started a program that was called EMSI, Emergency Services Innovative. And They've changed the name, but the idea is that we send out emergency folk to do screenings, to do blood pressure checks, because every county has emergency services. Almost every county has some kind of a fire department. And so the idea was they could come to that fire department, get those services instead of having to go to a doctor or something like that. So maybe working with the ACHs across the state, I'm sure that they're, very much into the mobile technology. And the thing of it is that they can capture all of the data because they have the software to be able to do that. So it's a great program with, I think it's called Better Health Now. No, it's Greater Health Now. Greater Health Now in our area. I used to manage that, but you might want to talk with Sharon Brown about that.
Yeah, that would be kind of right up this alley, I think, in terms of supporting that and maybe expanding that type of work. I think that would be great.
Any other questions? I got one question. I saw that the $50 million that was approved and the state over the next 5 years, it was $181 million. And I'm just running the numbers when I hear 50 billion. On that, do you know how long that $50 billion was going to be utilized for? Was that the same 5-year period? Is that for a 5-year period, or is that further?
Yeah. My understanding it's the 5-year period. And actually, I meant to update the slide. I just double checked it. That 181 million, from my understanding, is actually just for the first year.
Okay, that's what I wanted to get clarification. Because I was like, wow, look at the numbers, that's a small piece of the pie.
Exactly. Yeah. But no, if it's the same over 5 years, that's, that's a nice amount. And I had the same question. I was like, wait a second, I thought it was over 1 year. So I forgot to change that. But yeah, that's correct.
All right. Thank you very much. Because like I said, we were going to be shorted a little bit.
Right. Exactly.
All right. Thank you. Any other questions?
I do have one more question. Dr. Krieger, has it come up at all about the expanded role of the health districts? I mean, now that we have added more representation, has there been any feedback about, has it been a good thing? Are they monitoring that? Or, what's been the judgment on that?
Are you asking about like boards of health expanding?
Yes.
Yeah. Oh, that's a really good question. I don't know of any like formal kind of assessment that's been done. I think generally like health departments and boards of health kind of talk about what's working and what's not. But yeah, I haven't heard of any, more kind of like a formal assessment survey, that sort of thing. So it's a good question.
Just to piggyback on that, I think it's a good question, but at the same time, with the state being in a deficit, there's not a lot of money going to all one different programs. That's the unfortunate part.
Yeah.
All right. Any other questions? All right. We're going to move on. Thank you very much, Doctor.
We should have a commissioner join us online.
Oh, perfect. Do you know which one?
I'm not sure.
Okay. All right.
Commissioner Diddy, you're here.
All right. Thank you. All right, we're going to 6B rodent control update and discussion. And if you guys would introduce yourselves.
Sure. I have no idea who they are. All right. Hello, everyone. I'm Karen Hockaday, the Director for Surveillance and Investigation. I've got Jody Payton, who's the manager for our land use program. I wasn't here last month, but I understand Jody came and did a little bit of rodent education, and then we had promised to bring back some more information on just a little bit of scoping on what other local health jurisdictions, particularly Seattle, King County, since it sounds like they have a medical bus program, how they are handling rat control, rodent control programs in their agencies. So I'm going to talk a little bit about that overall scope. Jody has connected directly with some staff from Public Health Seattle, King County, so she'll talk more specifically about their program. And then, hope to get feedback from you all on where we want to go from there. So as we know, we kind of came to this discussion a while back because we have noted that we've had over the last couple of years a slight uptick. We have tracked our rodent complaints. We have not gone back and compared that, ratio of rat complaints to other complaints. But anecdotally, we've noticed a little bit of an uptick in complaints about rats specifically. So we kind of started talking about what we do here as a health district. I did some scoping around the state, and I did not find any health jurisdiction except for Public Health Seattle, King County that has a specific program for rodent control. And she'll talk about a few of those reasons why. Most other LHJs like us provide education and they provide prevention guidance. So if somebody calls, we can kind of educate on those mitigation factors for your property. There are no others except for Seattle, King County that I could find that go out and conduct direct inspections unless the complaint is tied into a different public health issue, like a solid waste complaint, a sewage complaint, or something directly related to a program we would inspect, like a school or a food establishment, which is how we handle that as well. Most will refer residents to private pest control programs, seek out your own pest control. We can advise you. We wouldn't share names of businesses, but we can advise you as how to do that, which is how we would typically handle response really to any other critter, right? There are a lot of other animals like skunks and squirrels and bats that are also could be zoonotic vectors. And we would advise the homeowner to go seek pest control services along with some education from our program. So in general, rodent control, from what I can find, unless it's in a larger, and this also pattern seems to hold nationwide, unless it's a larger urban county like Washington, D.C., New York, Seattle, rodent control is not typically a direct public health service. In some places, it looks like it's a public works or code enforcement because it's more of a nuisance issue. But usually not a direct response from public health authorities. There are some areas, and Jody will talk about it, like Seattle, King County, where they have local codes adopted by their boards of health specific to rodents. So as is, we really don't have the authority to come and say, we have to do an inspection of your property because we got a complaint about a rat. Again, unless there's another tie-in to a bigger public health issue, like a garbage issue, or it's at a regulated facility like a school or a food establishment. But that could be resolved if we had a local code. So that's kind of that first stepping stone. If we wanted to go in that direction, is we would need that statutory authority established for us to have, really any teeth to do anything about it.
And would that be the county's responsibility for that, bringing up that type of?
That'd be us. That'd be the Board of Health. Yeah. So
I want to make sure.
Like those other rules and regulations we've talked about, the on-site rule we worked on last year, a lot of local health jurisdictions have kind of a whole set of environmental health codes that their boards of health have adopted. Seattle, King County, from what I can find, is the only one that has a zoonotic code, but they do have one that specifically delegates them the authority to do these inspections and to have a little bit more of an enhanced program around their rodent control. They also do inspections of pet shops and temporary events where they may sell animals. So it's not just the private property complaints, but that's the basis for a lot of their response. So I'm gonna let Jody talk a little bit about Seattle's program, and then maybe we can have some discussion about where we want to see it go from there.
Okay. All right, I'm Jody Payton, the manager for the land use program. So the rodent program for Seattle is supported by the city of Seattle, and they contribute about $200,000 to that program, with some additional amounts coming from the general fund. King County itself does not really contribute any dollars, but it does provide some indirect costs and some overhead for being housed in the public health buildings. So that $200,000 provides 2 FTEs with the city of Seattle. They are expected to do all of Seattle for inspections. They have inspectors. They have to be an EHS and with an RS, and they all have to be certified pest control operators. So if they're going to do any baiting or anything like that, they have to have the certifications to do that. So if King County wanted to become covered, they would need to contribute enough to support about 1.5 to 2 FTEs as well. So as Erin mentioned, the Seattle specific issues are highly urbanized area. They have the Puget Sound right there with the port, and ports and rats kind of just go together. And many areas of Seattle are not allowed to have dumpsters. This was one thing I found very interesting. And I'll talk a little bit about more later. But they have shallow outfalls. They have stormwater that's directed to surface water in other areas. And so the outfall is where that end is. So the end between the pipe and the beginning of the surface water, That's an outfall, and that would be a great place for rats at that outfall. And then they also have old infrastructure with old brick sewers that are breaking down. So they have kind of two forms of rat control. They have the below rats and the above rats, above ground. So the below ground rats, the funding comes from the City of Seattle's public utilities. And the purpose is to keep the population at bay. They do the routine work of baiting the manholes, looking for hot spots, knocking down populations in general. They may have specific projects for specific areas. And they also get the privilege of the rats in the toilets complaints. But if you think about that, that is because of the infrastructure. Because if the rats are coming in through the toilet, there's damage in the sewer system. And so that they will help the homeowners find the broken or collapsed side sewers to get them fixed. And then they'll bait above and below that stream to try to get them under control. The above ground rats get funded by the City of Seattle and the Clean Cities Division. And they work with Seattle Parks, Department of Transport, code enforcement on mostly complaint basis. So they're only responding to complaints. They're not looking for them. They will investigate complaints as they come in. And when they come in, they have to be triaged. They can, if they're part of the Clean or Clear Alleys program, then they go get funded by that. Because like I said, a lot of areas in Seattle are not allowed to have dumpsters. They found too much bad stuff happening around dumpsters. So what they do is they pay for bags and they set them out several times during the day. And throughout the day, the garbage people will come and pick them up. So if the bags are opened or ripped open and there's debris, then they can come in because that's going to be a rat attractant. So places like Pioneer Square, the International District, those places, they cannot have the dumpsters. So they'll also address rodent infestations and try to get compliance with the property owners and the occupants. They, like I mentioned, they had a triage step program where they'll get the initial complaint. They will verify it with the person who made it. They will rank it with a 1, 2, or a 3. A 1 is the most serious, which would be a rat in a rental structure or structure with children or vulnerable adults, or rats in an occupied structure with a food source identified. And level 2 is the rat is found outside and there's a food source present. And a level 3 is the rat is found outside and there's harborage present. And depending on their 1, 2, 3 is the number of days they have to respond. So I think it's like 5, 10, and 20 goes up. So they will also look at the area to see if there's any neighboring complaints in that area to see if it's a bigger problem than just this one home or this one address. They verify the property ownership and the address. They contact the complainant and let them know that their complaint has been heard, it's being worked on. They are very careful not to make promises, which we all are. They only do a site visit if it's a city sanctioned dumpster-free alley complaint. Otherwise, they are writing a letter to the occupants of that residence and letting them know that there's a complaint in this area. They don't specifically call out them and their address. And then they will wait to see if they get any compliance with that. They will reach back out to the complainant and let them know that they were working on it and, you know, hey, have you seen any improvement? And if they say, yeah, I haven't seen a rat in so many days, then they'll close the case and they're done. If they don't get compliance, then they will send out a second letter and that will, no compliance again, then they will do the site visit. And the site visits are only if they have the capacity to do them. So each inspector has a maximum number of active cases that they are handling. And if that puts them over, they will not do the site visit until it comes up. So they're not able to do all of the site visits that you would think. They have a lack of compliance leads to civil penalties. So they can put a notice of violation, a notice and order. They can assess fines of $750 for a residential structure, up to $7,500 for a business. if they're not addressing these issues. And like Aaron mentioned before, they have the support with the Board of Health having its own ordinance, 8.6, which I put in your packet, that deals specifically with rat control. They are also providing education to the community, and they will do seminars and webinars and talks to people as they have the time. But again, it's as they have the time. Oh.
Okay, so pause, I guess, for questions. Are there any questions about what Jody shared about Seattle's program? I think, oh,
Go ahead. Do you have anybody have any questions?
Well, I wanted to ask you if, do you have any sense of whether or not these complaints are more detailed than just a sighting? I mean, are people just calling and saying, I saw a rat, or are they saying,
we've had a few. Actually, we had one this week for a food establishment. Somebody called and said that they found a rat in a food establishment. When the inspectors went out, it turned out to be mouse droppings. So there are some where they get them confused. The difference between a mouse dropping and a rat dropping is very clear. Jody also has a very fun tool that can measure them. But for the most part, people call about their neighbors. You know, sometimes they're calling about their property, and that's useful because then we can say, great, do you have some time for some education? We can stop, we can talk to them about what might be happening on their property, but often they're calling about the neighbors. And so that's that enforcement aspect where without the backing of a rule or a code that says, yes, we can, you know, go out, we can go scope it out. And if there's a clear hoarding issue or garbage issue or something going on, that would be handled through our typical solid waste enforcement process. But outside of that, we can likely share education. So I think with Seattle, they have integration with their city, they've got integration with their public works, they've got a locally adopted code, they've got a compliance and a civil penalty structure, they've got funding and dedicated staff. So it's going to look a little bit different than what we could potentially do here.
Commissioner Didier, do you have any questions? I know you're online. I want to make sure I have input if you have any input on this as well.
Commissioner Mullen is also online as well.
Oh, and Commissioner Mullen, any input from you guys?
Yeah, something that comes to mind here with me is Seattle with their homeless problem. What happens if they're residing around these businesses or up a street and they're caused by the homeless? Are they still issuing tickets to the business?
That is why they have the Clean Alleys program.
So well, are they clean though? I mean, I've been over to Seattle. There's homeless camps everywhere.
Yeah, that's a different issue. That's not under the rodent control, so I don't have the ability to answer that one.
Yeah, I would imagine like we would in a situation like that, they're probably taking those factors into account, working with the business owner. Usually I can't speak for Seattle, but usually in enforcement programs, you're going to take those factors into account, and sometimes those civil penalties might be waived if there's something else, and they can work with the person on that.
Yeah, I'm just wondering, I've been reading about the hoarding issue in Richland, and I think there's a couple of properties, and hoarding seems to be like a perfect opportunity for a rat, you know? Yep. So I don't know if the city has reached out, if Richland has reached out to the health department.
I've spoken with them, yeah. Those type of nuisance properties are complex because in our area, because we're a special purpose district and we're not integrated with a county system like some others, we don't have code enforcement on staff with us. So we have a lot of those type of issues where your county or city code enforcement may be handling it, and we also may be handling it through our solid waste program. So we talk.
Okay.
So we have talked, yeah, and usually whoever's going to have the more direct authority, we would say you handle this one, or we'll handle this one, or we'll do it together. So we work together a lot with code enforcement.
So I appreciate the presentation, and I'll kind of give you my feedback on it. At this point in time, I probably wouldn't be in favor, to be honest with you, of adding an ordinance on that or staff to do that. I think there's more things we could use our time for on that. I looked at the population of King County. It's 2.3 million. I just looked it up on my phone as you were speaking. And that's approximately 1.150 million per employee. That's a lot. And you're right. They have the ports here. So they have a lot of cargo ships coming in, a lot of trucking coming in, pretty condensed area. And so, yes, I think it would have more of an issue than we do here. Is it starting to come into question? Potentially, I get that. I understand that. But at this point in time, I wouldn't be in favor of doing something like that. I think our code enforcement, I was the liaison when I was a city councilman and as the mayor of Richland, where we had code enforcement, and they were pretty proactive on doing those type of things. Our code enforcement here at the county, pretty proactive on that. And you guys have been part of that too. And so we worked cooperative with both the health district and the county as well. So knowing that, knowing what valuable time and the funding we do have at this point in time, especially I know that the state's not really wanting to get too much money out to any of us, right? And I'm not claiming that or anything. I just think that we could use those resources more. And this may become something down the road. That was my thing. Anything you would have, Christian? Okay.
No, I'm just bummed that like this winter was so warm that the insects is gonna be on steroids. Like all the bugs to be crazy this spring. And then even the mice and rats, it's gonna be on steroids again this year too.
Yes.
Yeah, for how warm it is. But like one thing too on my house, I always have a landscape company come out and do some spraying.
Yep.
Exterior spraying for that. But then I also will go to Walmart or Home Depot and grab some mice traps or some of those sticky mice traps where I'll put it up inside the house by the doors, which helps out if a mouse does come in, it gets, so yeah, so I'm not too worried about mice or anything, but I get it where you're living. If you're living, in some more rural areas, but there's still mice where I live at too.
Oh yeah, they come in right before fall, coming in. Time to warm up. No, I totally get it. I respect it. Like I have a brand new German short hair puppy, and by golly, they're upland bird dogs. But he's very proud to bring me some type of rodent. And my wife's not too happy about that, right? But like I said, I think we're a little ahead of the curve on it. In my personal opinion, I'm looking at the numbers. If King County thought it was more of an issue, they would definitely put more money into that. When I'm looking at 1.1 million, I don't think we're there yet at the population we have. If I start hearing it in the papers more, if I start hearing it from constituents, I would be more concerned on it. But I think right now we can spend our resources in more valuable places that we need it for sure.
So I'm glad to report that I have not seen a rat since what was January. I think that I reported seeing one, and I haven't seen one since. We have rat traps out now, but I think it was just an anomaly. But this is a great graphic. I would love to see this on the health book or the Facebook page,
To use King County's infographics and flyers and things like that. We are able to put a link to them, whether we put them directly on ours or provide a link to King County, but we can definitely use
Great.
That's where my mind is going. I think that's something we can definitely commit to supporting some expanded education. We talked about our staff go out to outreach events a lot. We can take information with us. I agree. I don't think a local ordinance would be a bad idea in the long run, but this is a good example of a program that's supported by FPHS, and with cuts happening there. Our land use staff also use these funds to respond to other zoonotic concerns, like the almost 700 dog bite complaints we got last year. So those funds are kind of tapped at this point. So that expanded education, maybe some more forward stuff on our website. We'll commit to continue tracking these, and really we have purview over public health nuisances, but a nuisance becomes a nuisance when it broadly affects the community. And so we'll keep an eye on that. And if we do feel like there's a concern, maybe there's an area for some collaboration with code enforcement and the counties to come together and do some community education on this.
So I totally agree. I really appreciate that. Anybody online, Dr. Kwandi, any of the commissioners, any other comments? Before we move on?
So I have.
Oh yeah, I'm sorry. I apologize. Go ahead.
But I'll wait. Go ahead.
I don't have anything. I'm good.
All right, thank you.
So I was just going to ask if it does start to increase, you're hearing more and more about it and wanted to bring it back. Could you also see if there are any measures about how effective the Seattle approach has been? And are they going at this and using the legalities and then still having a rat problem? Is it actually worsening despite 2 FTEs, or is it improving? Are they effective or not? And then the other question I had was, you do have this great pamphlet. If there's a complaint from one person, can you get that zip code and maybe mail a few of these up and down the street?
Because one thing Seattle said that they'll do is they'll do neighborhood mailings. If they start to see a lot of complaints in one area, they'll kind of blast. And we were talking about maybe doing a postcard or something like that could be easy and ready to mail out. So will enhance some of that. And I think that's a little bit more passive. It doesn't add too much staff capacity, tap our staff capacity there.
That's actually really good because I think that makes a lot of sense because then you're gonna. kind of-
My neighbors, if anybody got one of those, all my neighbors would be talking in the middle of the street, and like, hey, did you know about this?
I'm
And
gonna blame it on my neighbor. I'm just teasing. I got the neighbors. Just joking.
I'm not his neighbor, for the record.
Okay, well, that's all we have unless there's other questions. All right.
All right, thank you. All right, we're gonna move down to 6C, Nurse Family Partnership Update and recognition of Home Visitor Month.
Okay.
And if you just go ahead and state your names, I appreciate it. Thank you.
Hey, so my name is Barb Johnson and I'm the supervisor for Nurse Family Partnership. This is Susie Bachman Thomas and she's a nurse home visitor. We would like to call attention to the home visiting, honoring home visitors for the month of April and specifically Home Visitor Week, the third week in April. So there's a couple things that we would like to do today. And the first thing, well, there's three things I'd like to do right off the bat. And the first thing is to thank all of the Board of Health for your support for our program. And we're going to go through some of the successes and some of the statistics on the handout that Amanda was so kind to me. The second thing is to invite board members to accompany a nurse on a home visit. And we're going to give a nod to Commissioner Alvarez, who's already graciously done that. And if you have a population that is near and dear to your heart, teen moms, moms with mental health issues, substance use, if you let me know that, and I have some cards, I'll give you cards so that you can contact me. Let me know your soft spot, and we'll see if we can connect you with a nurse and a client to go out and visit with them. The third thing is we'd like to invite Benton County to explore expansion of this program. And one of the expansion areas, we did have 2 nurses. And if you look on the back part, we only have 1 nurse right now for Benton County. We can serve 25 clients. We have 4 nurses for Franklin County, and we can serve 100 clients in Franklin County. 125 low-income, first-time moms for Benton-Franklin. That's a pretty small number. There are other programs with Nurse Family Partnership, like Nurse Family Partnership X, which allows nurses to work with families, not their first time pregnancy, but with other pregnancies that need additional support. So last year we had 41 completions, and I want you to think about 125 that we're able to take, 41 completions. This year we have 49 completions. That represents 2.5 years in the life of a client and their child. It represents about 3,500 hours of direct nurse services. So as a result of that direct service, I want to let you know what your investment has reaped. 15 high school completions, 3 master's degrees, 5 enrolled in college, 2 have completed post-secondary degrees. We screen about 90% of our first-time moms for postpartum depression and then make referrals. We also have the highest assessment rate for looking at developmental screenings for all of Washington State and for national statistics for all NFP programs. So I'm the numbers person. The mind, and now I'm going to introduce you to the heart, and she's going to give you some stories from the field. Go for it.
So one of the questions that we get asked a lot is why nurses? Why can't a paraprofessional do this? Well, as nurses, we're always assessing. We're assessing situations, we're assessing things that the family says, or the environment, safety, development, and people, just to name a few. So recently I had a breastfed baby and mom reported about 4 weeks in that all of a sudden the baby started spitting up after feeds. And I had been seeing, well, we see newborn babies about every 7 to 10 days. And I was weighing the baby, and the baby was channeling about the 50% or a little bit higher in her weight gain. And I said, well, let's wait and see, because spitty babies, they're normal as long as they're gaining weight. So a week later, I went back and mom says, no, the spitting's getting worse. So I said to mom, I said, listen, you need to follow up with the doctor. I don't care if you go to the emergency room. I don't care if you go to your PCP, but this baby needs to be evaluated for pyloric stenosis. Pyloric stenosis is a condition that manifests about 4 to 8 weeks after birth, and it's where the muscle between the stomach and the small intestine thickens, and so the food can't get through. And when we see spitty babies, if they're gaining weight, we don't worry about it. But in this particular case, the baby was starting to lose weight. While I was at the visit prior to the baby seeing the provider, I observed this spittiness, and it reached from here to that chair. And I knew, I had no doubt. I don't diagnose because I'm not a doctor, but I knew. So I spoke with both mom and dad, and I let them know that they really, really needed to take this baby in. I said, I would prefer if you take the baby to the emergency room. However, it's your choice. Well, baby already had appointments scheduled for the following Monday, so the parents chose to wait. That's fine. I left a piece of paper and I said, please give this to the doctor wherever you end up. And on the paper, I just wrote, please evaluate this baby for pyloric stenosis. Following week, I followed up with mom. They had seen the primary care provider. They had given the piece of paper to the nurse, and the mom expressed her concerns to the primary care provider. And the mom told me that the primary care provider had actually seen one of these episodes of spittiness. And the primary care provider sadly said to mom, you're just overfeeding your baby. Send her home. So I kept working with the family, because that's what we do, and encouraging them, you need to take this baby to the emergency room. You need to take this baby to the emergency room. Well, after several weeks of this, baby had dropped down below the 2nd percentile on the growth grid. And finally, I sent mom, I asked Barb, can I send the mom a picture, a snapshot on my phone of this growth grid? She says, as long as there's no identifying information, sure. So I sent the mom a picture and I said, please take this to the doctor and show them how your baby's weight has dropped. Well, that was what triggered mom to take the baby in, because she saw the decline in the baby's weight. So they went to the emergency room, and the emergency room did evaluate the baby for pyloric stenosis. And they told the parents, would you like to take the baby to Spokane yourself, or would you like us to send the baby in an ambulance, because the baby will have surgery today? We've already talked to them. So the parents opted to take the baby themselves. Baby got surgery, and I can honestly tell you that today that baby's weight is fabulous. We are still working on some development stuff, because you can't be sick and develop at the same time. It's either or. And so we're going to get that baby caught up just because of that. The second story, I just recently got a phone call from a person that, and when I answered the phone, she goes, Susie, do you know who this is? I said, yeah, isn't this Maria Jesus? And she goes, no. I said, then I have no clue who it is. And she identified herself as a graduate from 2019. They had a little boy that about 4 months of age started demonstrating autistic tendencies. Now, if you guys know anything about autism, it cannot be officially diagnosed until about 2 years of age. However, as we did our developmental screens, we started seeing more and more tendencies. So we made referrals, got that kid into services. So as soon as they could be diagnosed, they were diagnosed. Mom said that since graduation, she had gone and gotten her certificate in dealing with children with autism. So she was now a caretaker, not just for her son, but for other children. Dad had gone on and completed his master's, and 3 years ago they had moved to Florida because of Dad's job. She says, however, the real reason for the call is to say hi, but we were eating dinner tonight and our son saw your picture up on the wall. And he wanted to know who that was. And we told him, oh, that was your nurse. She's the one that helped us, with you and got you into services and got you what you needed. He says, I need to call her. So the mom, he's 8 now. Mom called me and she said, here's my son. And he got on the phone. He says, Susie, I just wanted to thank you for all you did for our family.
Yeah, makes me tear up every time. So, just to wrap a couple things up, the reason that we have nurses is not only because of the relationship that they build over 2.5 years. It's because of their knowledge base and because they assess every minute that they're with the family to see what the family needs. On the last note, we will have a graduation. It will be at the Carousel of Dreams again this year. It will be September 19th. That's a Saturday in the morning. We'll send you the invitations. If you would like to just show up and see some of the clients in your districts, that would be great. But yeah, we like to celebrate successes, and that's how we'll do it this year. And thank you.
Oh, I'm gonna go online. I have questions.
Okay.
So Dr. Kawandi, both of my fellow peer commissioners in Franklin County, any questions online that you would have? Seeing that, we'll do it in the room here. Any questions or comments you guys would have?
Just congratulations. Thank you very much.
Oh, welcome. It's our pleasure.
So I'm going to ask a couple of questions. I was taking notes as I was listening again. And this was before I got on the Board of Commissioners here in Benton County. I see and I'm very pro this program. I like this program. I think it's very beneficial. So much I'm going to share a little personal story. So my mom had me on her 15th birthday. And those programs may not have existed at that point in time. I have 2 younger brothers. Obviously my dad, I was the only one that graduated from high school, served in the United States Marine Corps, and first one to go to college. And so once I got them about that, I encouraged my entire family to go through, get their GEDs in high school, blah, blah, blah. So I like this program. I actually did visit a house and the nurse and the rapport she had with the young mother and the child was really good. And I could see when I was listening to it all, I could see the progress of how the nurse was helping this young mother move forward. So I like that. So going with that, set the stage. I have a couple questions. There's 4 nurses in Franklin County serving 100 families, 1 nurse in Benton County serving 25 families. I don't know how that evolved, so I do have a couple questions. Was there grant? I have to understand the funding because that's our job.
Yeah.
Was it because of the population? Did they get more grants, or was there something that for funding we're able to go ahead and fund more nurses in Franklin County versus Benton County? How did that funding source come, and do you know how that was derived? Was it
the original funding source or the original program began in Franklin County in 2013, and that was to look at high-risk families. And there were more high-risk families in Franklin County than there were in Benton County. Benton County did not want to be left behind, so they took some of their crime tax,
public sales tax,
and that's where they funded us. They funded 2 nurses. But when some of those began to get cut, then one of our nurses got cut at that point too.
Okay.
So to answer your question, they are grant funded.
Yes.
Perfect.
Federal grant.
That's how I have to understand it so I can figure out how to get to the source to make it work. And it looks like, 1 nurse, I can see out of the 100 families and the 4 nurses, 25 per nurse, there's 7, there's a capacity for 7 more than on an active wait list for Franklin County.
Right.
And then Benton County, if we had one nurse, that would definitely cover the 8 that are on an active wait list now and have a surplus here to potentially support others. Am I correct? I'm just looking at this.
You're correct. And right now, that nurse in Benton County is gonna lose 9 this year. She's got 9 completions out of the 25 that she's got. So those 8 will be brought into her caseload. But that's 8 on the wait list right now, and we're in March right now. So we get, because one of our things that we wanted to do was make sure that we had longevity with our clients and make sure that they stayed till completion. We looked at how we could reinforce and increase our referrals in the community and establish some relationships. So as you can see, our referrals have been increasing, but our manpower is not.
Yeah.
So.
No, that totally makes sense. And like I said, I think that young mother there, she was looking at moving forward, but we get back in the workforce as well.
Right.
Which I think is positive. It's also positive for mental health for that individual. Plus, just getting back in, I think it's an active thing. So I look at that. I look at the graduations. I look at the whole 9 yards. So I appreciate this one. Hits home a little bit. So I appreciate the presentation. I'll go back. I'm a numbers person too. That's what we'll go ahead and do. So I appreciate it on my side. Any other questions you guys may have?
That's fine.
Okay. Well, thank you guys very much.
Okay, thank you.
All right, we're going down to item number 7. Let's see, education day. You're up to that.
Sorry about that noise. I was just checking in. Is it possible?
Sure.
Do you cut them? Possible to get the end of the yeah, I already did. Oh, okay. I just don't see it. Yeah, we'll grab this one. This is like a Vanna white. Okay, cool. I'm so ready. Okay. And if you haven't had a chance to look on Facebook too, our communications coordinator Noelle did a really great job capturing the moment of the graduation in October. It was really cool. So she's gonna be there again from our seats, but having been to some of the visits would be awesome. I love what you guys do. So we're very happy here. Okay, quick update. As you can see from the slide, this is the behind the scenes group. It was also posted on social media of us preparing for Ledge Day. This is when I gave out the binder. Funny enough, I used to do this for pageant interviews way back in the day. So like, it's got everything you need. So just to give you an idea of what we did, next slide. I'll pass this around and it has the agenda and then it has the meeting prep. I was able to break down all of the work that our team had done. And then we have very detailed digging on all of our elected leaders. So
Amanda, we should share that summary with the board.
the summary,
The ones
the
that,
handout.
yeah.
Oh, it is.
Oh, perfect.
Yeah. And you have a handout.
Oh, not that one.
Not that one. The other one. There is also another really great handout that has some of the updates on bills and FHS. We will send that to you in an email. So really, I just wanted to show you kind of the work that we did in preparation. I just did the computer behind the scenes, and then our team shined at Ledge Day, as Dr. Kreger had mentioned. So just to tell you what's currently we're watching is Senate Bill 6291 on-site wastewater treatment system inspections that Aaron had worked on. And that's pretty exciting because it passed both House and Senate unanimously, 49-0. It is now delivered to the governor for the signature. So we're just waiting for that. Again, it's making an opportunity, for my very simplistic terminology, more time for our on-site wastewater system inspectors to take the exam. So at least they're able to have that extra time. Or anything like me, I don't like tests. And then you'll see the handout, which again, we'll send you another one. This just kind of give you an example of what we talked about. Gives you a little bit more list of our programs. What was really exciting for me that I didn't know we were doing was a lot of the agricultural work and the outreach. I think when it comes to rural health, what Dr. Kreger was mentioning, and then some of the stuff we're already doing here, it's going to be really exciting to see where that goes and how far we take that. So we're really showing, we're serving our entire region and especially the areas that are, feeding our communities. So that's really fun. Next slide, and this is my last. Erin Hockaday. She is so over this. No, I'm just kidding. She has been nominated and actually won one of the 2026 Tri-Cities People of Influence for the Tri-City Area Journal of Business. I did print out her interview. I guess it was like a 2-hour fillable survey, something along those lines. They were very thorough. But what I learned about Erin, some that you might already know, is that she was honored to be selected to participate in revising the Environmental Health and Safety Code, as she's brought to you here before, K through 12, which was not updated for nearly 50 years. So that I thought was a fun fact. Another one, her first job was watering plants at the Columbia Grain and Feed in Pasco, not managed. Also, if you don't know this, which I still find surprising every day, is that she considers herself a complete introvert. She loves gardening, reading, and recently learned to crochet. But if you've ever had a chance to see her fully work in front of the community, it doesn't scream introvert at all. So she's really done a great job in leadership. I mean, all of our directors have, but it's pretty exciting to be able to see some of the work that we're working on now. With unlicensed food vendors and everything moving forward. And so if you need any gardening tips or any tips on food safety or rats, Erin is your gal. So again, congratulations, Erin. We had a great show of support, which was actually mentioned by the Tri-Deck executive director, said we showed up, and definitely did. Both for our community and for our team. So those are my really fast updates. Any questions that you guys have?
Love the small talk openers in your presentations.
Oh, yes. I found a lot of very interesting things about our elected officials. I have yet to do one on you, Alvarez. We will continue our search, but used my reporter skills for good. So.
For good.
For good. All for good. Anyways, okay. Well, thank you.
We should do a chant for Erin real quick. Let's go, Erin. Let's go, Erin. Woo!
I'm gonna note, introverts can be amazing at social interactions and people. They're just also really great at spending time with themselves.
All right, we're going to move on to item number 8. Is the approval of vouchers. Do I have a motion to approve this?
Mr. Chair, I'll move that the Board of Health approves the payment of vouchers number 1226 through 2026 through 2026 in the amount of $1,120,783.03.
3 cents.
Second. 3 cents.
Have a motion and a second. All in favor signify by saying aye.
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 Thank you. And the motion passes. We'll move down to executive session. A discussion of legal counsel about competition litigation for RCW 42.30.110. One, and how long do we need?
Let's do 15 minutes to include Chris Mertens, myself.
Perfect. So the time is.
And the board.
We'll give it time. 2:30. I think everybody out. Perfect. The time is 2:45. We're out of executive session. No decisions were made. We're moving on to item number 10, closed session review and discussion of collective bargaining for RCW 42.30.140.4A. And how long do we need?
Let's do 10 minutes.
And we're going to do 10 minutes.
For closed session.
And who's going to be included in that one?
That will be Brandy, myself, and the board.
Perfect.
Sorry. Chris, you're free and clear. Thank you. You're free.
But not clear, huh?
All right, perfect. We're out of executive session. No decisions were a closed session. No decisions were made. I do, before I go ahead and go to item number 11 for the next meeting, either one of the Franklin County Commissioners or Dr. Kwandi, you have any other closing comments you'd like to make?
You guys are doing fantastic. That's all.
Thank you, Dr. Kwandi. Commissioner Mullen, Commissioner Didier, any other final comments before we start closing it out?
No comment.
Thank you, sir.
No comment.
Thank you, sir. Anybody here at on the board here in person? We do not have any final comments on that, or closing comments, so I'll go to number 11. Date of next meeting is April 15th, 2026. And at that, meeting adjourned. Thank you all.
Good job.
Okay.